Go visit the headquarters of CERN in Oakland, and there's a lot of really interesting work happening there, and a lot of interesting collaboration happening between folks all over the world, but also particularly with some of our friends in China. And we're going to have a number of folks who are going to come in and give presentations. My name is Ben Allen. I'm a state senator representing the west side of Los Angeles, including UCLA, the coastal South Bay. We're also going to be hearing from our assembly speaker, who is on his way, Anthony Brendan. He'll say a few words. Philip Chen as well, who's an assembly member from Kevin Chu. He's the president of the International Society of Regenerative Medicine and Wound Repair. And the society itself actually technically was established here at the Capitol a year ago. And it's dedicated to the development and promotion of regenerative medicine through research and development, education, policymaking, and clinical studies. Folks also know that Kevin's father was an important leader in this area on the scientific side in China, and Kevin's been keeping his tradition going strong. I've had the opportunity to visit their facilities in China, and so we'll be hearing from Kevin in a minute, but. Why don't we hear from Kevin as an introduction, and we have a seat for the speaker. And our honorable speaker is a great champion of medical research. Yes. And we're excited to have him here at his briefing.
Good to see everybody in the health field and in research medicine and medical advances. We want to make sure that we continue to lead the world. We want to make sure that we continue to change the world. And it's these types of discussions and this type of leadership by Kevin and his family that help to ensure that continues. So I want to thank our panelists for being here. I want to thank everyone for being here. Thank our senators and Assemblymember Chen for being here. And it's an honor to be here. Thank you.
Hello everyone, welcome to the state capitol, and welcome to the second annual meeting of the Regenerative Medicine briefing. And also I want to thank the Speaker's Office for coordinating everything, and I want to thank Senator Allen, Assemblymember Chen, and also all my old and new friends. And I think this is one of the special moments, because last year, when we talked about establish such an international society, our goal was to bring application closer to our living. And also, we be able to actually try to help more people as much as we could. And here I want to actually take a short moment to talk about my last trip to Panama. Actually, I was in Panama just a couple of weeks ago, and I was visiting the humanitarian hub, which newly established there, which happened last December. And what I've seen is that right now in Latin America, even the Central American region, they actually lack of a lot of, there are shortage on doctors who are specialized and practicing on wound care and regenerative medicines. So one of the, I would say, it's not only arranged by the string of fate, but what's been going on, we all know that just a couple of days ago, in Ecuador, there's an earthquake. And it was just right after we visiting the humanitarian hub. And then I realized that from the Red Cross and also the United Nations Rescue Team, they are trying to set up the storage, kind of like the human response depot in the humanitarian hub. And it just, at the time that we realized we need to prepare ourselves. We need to be educated. And for this platform, one of the major reasons is for, I would say, our legislators, our lawmakers have a closer understanding and deeper understanding on how the epidemic have carried and how the directions have taken. So I want to thank our speakers, and I want to thank our speaker to have this opportunity to enlighten our knowledge. And thank everyone.
His father was a physician in China, and at that time it was called physicians that didn't wear any shoes because they couldn't afford shoes, and he would go out to the countryside, to rural areas that didn't have the opportunity to see hospitals, to see urgent care centers, and bring this growing treatment to heal the residents in that area with this life-saving cream. And I thought the potential and the opportunities are endless of understanding regenerative life sciences. You could go into our areas that our military are in. They can go into areas that we don't have emergency rooms and we don't have urgent care centers. So I want to thank them for their leadership and their philanthropy all throughout the education system throughout the United States. They have a site in Harvard. They have a place at UCLA, at USC, at CASA Los Angeles to talk about this life-saving technology. So I want to thank you for allowing me to be here today and the partnerships that he's made with Senator Ben Allen and Speaker Rendon again for their advocacy. So it's a pleasure to be here, and I look forward to the presentation.
Our culture of a highly interactive and synergistic research community, combined with a close interaction with industry and entrepreneurs, we work to ensure that promising discoveries will lead to the creation of new therapies. As you all know, UC is a top recipient of grant funding from the California Institute of Regenerative Medicine. I have an astounding number to report. The UC system as a whole received about $1 billion from CERN towards the development, research, infrastructure, clinical trial, translation, and educational programs. And that's very significant. So as a public research university, we have a mission to actively work with industry to translate all these great discoveries into therapies that can impact the lives of many. As they say, it takes a village. It really takes truly a village of tenacious researchers, doctors, compassionate donors, visionary policymakers, strategic corporate partners, disruptive entrepreneurs, and technologies to advance these endeavors. So it's a pleasure to be here today. I'm in great company, and thank you for contributing to this conversation. Great, and right now I'd like to introduce my colleagues with me today. First we'll be hearing from Dr. Lindeman. He's the Director of Health at the Center for Information Technology Research in the Interest of Society, CITRIS. He's also the Director at the Center for Technology and Aging. So please, Dr. Lindeman.
But there are many issues here that we are facing. So let me take you through very quickly. The Institute for Science and Innovation, particularly CITRIS, is a multi-campus program under the Office of the President. And again, we're very thankful for President Napolitano's support, where we actually use state of California funds and leverage it by 25 times to reach individual funding from the federal government, industry, and philanthropy to impact society. In our case, we focus not only on health and aging, but have tremendous work looking at hardware, software solutions in sustainable infrastructure projects, robotics, and so very quickly, a few examples. First, a wonderful program showing a collaboration, UC San Francisco, UC Berkeley, UC Davis, creating one of the very first platforms to connect electronic health records, bringing information to professionals and back to older adults so that people can have actionable data. This is a huge challenge. Here in California, we're tackling this with one of the very first solutions. Similarly, our telehealth program, out of the UC Davis program, we have the largest state telehealth program in the country. Now that CMS is reimbursing in this area, we are in the lead to be able to take advantage of this, bringing care to where people are, as opposed to having them come to physicians' offices or hospitals. We're also looking at falls prevention, not just measuring falls for tracking, but preventing them. If I can get a video to work afterwards, I will show you the example of our first company coming out of our UC Berkeley CITRIS Innovation Program that has already been accepted in 6 states, been accepted by our State Department of Social Services as a go-to program to identify individuals in assisted living and preventing falls by up to 40% and unintended or different types of emergency room visits by 60%. Huge cost savings to our state of California. We're also seeing new innovations to track one of the other problems that has been significant in this area. We've gone from physical abuse of older adults to financial abuse. And in this case, we see some of our startup companies tackling this area and working with banks and insurance companies to help monitor and the safekeeping of the resources of individual older adults. And now we take advantage of some of the other exciting developments in our University of California system, using sensors and technology for smart homes, being able to actually track where people are, monitor the environment, and help individuals control their home situations so that they can avoid falls and other problem sets in that area. And now we're seeing advances in medication adherence, which is also one of the greatest problems sets for forcing individuals to not be able to stay at home. As we now have a huge percentage of older adults over the age of 80 that are taking up to 10 medications a day. And we've moved from being able to have just pill boxes to apps to help them, and now we see companies that we're working with using ingestibles that actually will track the medication that individuals take so that we can better monitor and measure what individuals are taking or not taking. And finally, final points, we're seeing the benefits of our new technology solutions in virtual reality and augmented reality, where we're able to now train individuals in how to better take care of older adults and become very efficient in the workforce. And working closely with social robotics and transportation companies that we have, how we will be able to help individuals stay independent and reduce isolation. One of the areas I'd like to reinforce, we're working with AARP at the national level, is looking at new issues around next generation of hearing devices. Only 15% of people currently take advantage or have access to hearing aids. We are now seeing in the next year or two, the FDA will approve over-the-counter hearing devices that will be affordable and accessible, which will change the way people can now get access to that and create ways to stay independent. And finally, voice recognition, natural language processing, the way we can now interact and work with larger companies to get information from individuals where they are at home. So, what's behind all this? Final points I'd like to reinforce, and this is part of the University of California Innovation Hub, and that is data analytics. Our expertise in machine intelligence, artificial intelligence, and machine learning across the UCs, but particularly now the new data science division at UC Berkeley, which has launched the very first in the country data science division. We are now tackling how all of these technologies come together and use information. And it's particularly as we see this huge explosion of technology solutions, ways technology are connected. This year alone, we're at over 35 billion connected devices. Just in 2 years, we're going to be over 50 billion connected devices. How do we take advantage of this massive amount of information? So what we're seeing in the University of California now is expertise, looking not only at ways we tackle this for healthcare, but the ways we look at technology to address all different types of impactful issues in society. So, in closing, we have massive amounts of data coming our way. And you're going to hear more about that in terms of how it's used in clinical applications. We have challenges how we use that. What we've seen in the University of California is creative co-design and universal design in this area, leading to new companies, new innovations, greater impact for individuals, and of course, ultimately, solutions that will benefit the people of California. So at this point, I think I've used up my time, so I will defer on the video, and maybe we can do that afterwards. But I'd like to turn it over to my colleague.
Stem cell therapies is actually not a very new technology. Bone marrow transplants started in 1956. The millionth patient was administered bone marrow transplant just a couple years ago. Hundreds of thousands of lives have been saved. And although we traditionally call this a bone marrow transplant, it's really a stem cell treatment. The active pharmaceutical ingredient in the bone marrow is a very particular type of stem cell. Turns out the same type of stem cell is available in cord blood. So that's the blood that drains from the umbilical cord when a child is delivered. And that happens to be a much better, richer source for these cells. So a lot of us in the stem cell field have now started to focus on that. As part of that effort, we've taken some of the funds from the state of California and developed an umbilical cord collection program that covers the whole state of California, which is a large and ethnically diverse population across California. This is in partnership with a lot of different hospitals and a lot of the major metropolitan areas. Part of why this is so important to have here in California is because we have such a large ethnic diversity. It is extremely challenging to match patients. You have to make sure that the immune system of the donor cells that you're giving match that of the recipient patient. And because we're launching and maintaining this program across the state, we're able to capture a very large ethnic diverse population. There's been over 2,000 units of these cord blood stem cells collected, about half of which have been used for researchers as they try to develop new therapeutics, and 43 patients have been administered these therapies, life-saving therapies. Some of us have also focused on this crossroads of taking stem cell-based therapies and crossing them with gene therapies. So for instance, our director of the Stem Cell Institute at UC Davis has a very long history in doing this with a huge leader in the field, Don Cohn, where they developed a genetically modified stem cell treatment to cure quote-unquote bubble boy disease. Bubble boy disease is one of these diseases where we know the cause, it's one mutation in one gene, and this therapeutic platform of combining stem cells and gene therapies together allow you to treat all these quote-unquote monogenic diseases. Individually, they're all very well rare, but if you scoop up the number of patients that are affected by these diseases, it's a sizable patient population. This is more in the basic science realm at the moment, but it's something to keep on our radar, which is this idea of growing an organ in a dish. These quote-unquote mini organoids, it's starting to be a reality. It's moving beyond science fiction. It's still not without challenges and hasn't quite made it to the clinical trial stage, but it's something that is on a lot of our radars and something we're actively pursuing. And there are several projects throughout the UC system that focus on that, including liver organoids, and as well as
an organoid, tell us what that is.
It's a mini version of your organ. So for instance, if you need a liver transplant, the amount of patients that need a liver transplant far exceeds the number of available organs that are available for harvest. So most of those patients go on this substantial wait list and never end up receiving the actual organ. So the idea is, well, can we actually grow a liver in a dish and basically mixing all the constituents? Liver is a very complex mixture of a bunch of different cell types and tissue components, and the idea is to grow that organ up in a mini fashion. It's much easier to grow it up tiny and then see if you can keep growing it up to a larger and larger clinically relevant.
Within the body or?
Outside of the body, and then it would be transplanted within. So it'd be grown in a dish.
But it would grow to full size in the dish, or would grow?
Reaching the full size is probably a bit of a stretch and a challenge. The idea would be to, depending on what organ we're talking about, there'd likely be smaller versions of the organ.
And it can sort of perform the functions to a decent extent.
Exactly. Again, that's still in the basic science realm. I don't want to oversell that. It's something that's on the radar. In terms of what's actually going to affect patients in the near term, it's these so-called mesenchymal stem cells. That's really the bit of well in the ocean, so to speak. So if you go to clinicaltrials.gov, there's hundreds of clinical trials of these stem cells for a variety of different diseases. Happens to be the cell type that I specialize in myself. But we're also working on making even these therapies that have shown so much promise even better. So I won't bore the audience with too many of the details, but there are these little nanovesicles that are a derivative of these stem cells, and it turns out we figured out that we can take all of the healing power of the stem cells and concentrate it down to a very high magnitude, and the nutshell take home of that is we can make these stem cell therapeutics more potent, more consistent, and a much cheaper cost of goods to manufacture. I could not leave in good conscience without mentioning the idea of stem cell tourism, which is a growing burden, not only abroad, but it's becoming to be a bigger issue here in the U.S. There's actually a couple of these so-called stem cell clinics in Sacramento. The idea is that these clinics are administering unproven, untested therapeutics. You actually don't really know for sure what you're getting injected with. There are many examples and case studies across the country and across the world where patients have had very bad effects come about for this, including patients becoming blind, dying, and so forth. It's a huge issue. The FDA is supposed to regulate this. They're extremely understaffed and underpowered. So it's something we should definitely keep on our radar. We'd also like to mention, we're very thankful to the state. We recently got a state appropriation for $12 million to consolidate a bunch of our expertise, not only here in California, but across the country to develop therapeutics for one of these rare monogenetic diseases I mentioned called the Jordan syndrome. And we also were benefited from another allocation of funds from Governor Brown to help develop this AGSI Square. This would be a substantial expansion and growth of the medical center here with the stem cell regenerative medicine therapeutic pipeline being one of the crown jewels of that. So thank you to the state, and we're definitely leveraging these funds for the benefit of California. And I will leave on the note that a lot of us come up here and speak and we talk about all the great things that we're doing, but behind each one of these projects is a huge team of very smart, very hardworking people. And so I just want to say thank you to everyone that's worked on this. And that's it.
Fantastic, thank you. Well, so thank you for the presentations, and obviously thank you for all the hard work that goes behind the work you described. Just a couple of quick questions. I mean, I remember that this whole initiative came out of a kind of response to a slowdown or shutdown of stem cell research at the national level, largely because of religious conservatives being concerned about the use of fetuses in this research. Can you speak to that controversy, where it stands today, and the interrelationship with the new administration in this area from a policy perspective?
I can take that if you don't mind. So, exactly right. It's a bit less of a concern nowadays, in no small part due to the fact that most of the cells that we're talking about using for these clinical trials are not derived from fetuses in the least bit.
And they used to be much more?
There's several different kinds of stem cell technology. They're the kinds that are not currently in clinical trials for the most part. Some of them have been used from these fertilized eggs from in vitro fertilization clinics, which were normally thrown away. Instead of throwing them away, they just developed stem cell technology to save lives from these discarded cells. And the Bush administration did not like that line of research, and they put a halt to putting federal funds behind those research endeavors. That's been something that has been lifted, but I would say that most of what I presented here today are actually having to do with adult stem cells. So right now, as an adult, we have several different little compartments in our body that are filled with different flavors of stem cells. And the kinds of clinical trials we're talking about here, the vast majority of them are from adult tissue.
And has the new administration weighed into this area? I know that, I mean, for example, we were just talking about this in caucus today, there's a huge controversy now over gap rule, unrelated to this, but related to abortion, of course. Has this been an area where there's been noise of a reinsertion of the federal administration?
There has been a lot of verbiage. I don't know that anything's concretely, as far as I'm aware, taking place on a policy level. Whether that stays in that situation going forward, I think remains to be seen. But I would say that even just using certain intonations makes people wary. If you're Pfizer, if you're Bayer, if you're Johnson & Johnson and you're thinking about investing in this risky new technology, and part of how you're getting these therapeutics developed is through government subsidization of technology, which is how things work here in the U.S. And that subsidy potentially stopping, that makes you, that adds onto the risky side of things. So it's definitely something they consider, and it has been a hindrance. Again, these adult stem cells get around that, but it has been a hindrance in terms of developing these so-called embryonic stem cell therapies. And I just want a little tiny thing. Even the idea of using embryonic stem cells is a little bit growing out of fashion. It turns out you can take a skin biopsy from a patient, anybody, from Dr. Lemon, for myself, put that piece of skin in a dish and trick it into reverting back to a very immature state, so it thinks it's an embryonic stem cell. So you can actually use this tissue from an adult, a little skin biopsy for myself, to develop essentially similar technology.
This is something I think that Portantino, the former Senator Portantino, did a bill. I think he did the bill that facilitated this.
Yeah, I think, and it's such a great deal. It's only a $2 charge on birth certificate licenses, which it almost seems unfathomable that would actually fund this program. But yeah, it's not a bad deal.
Can you tell us, I mean, either of you, what are the most promising stems, kind of therapies that are making their way through clinical trials in terms of FDA approval? What's closest to coming to fruition?
Sorry, I don't mean to monopolize the conversation here. Everyone's talking about these gosh darn CAR T cells, C-A-R T cells. And it's a way that researchers have found to trick immune cells to attack specific flavors of cancer. So whenever you get a tumor, your immune system does a bunch of really great things and tries to kill the tumor on its own. Successful tumors find a way to trick the immune system to shut it down, to keep the immune system from attacking the tumor. What these CAR T cells are is a type of stem cell therapy where you take these immune stem cells and you engineer them in a dish to overcome these defense mechanisms that the tumors develop to attack. And it's worked remarkably well in a subset of patients that have been traditionally difficult to treat. So there's several recently approved in the last couple of years, and there's many more on deck to come through the pipeline. After the CAR T cells, it's probably mesenchymal stem cells, which are more of a tissue regenerative approach.
Okay. And has the state of California, I mean, how close are we to monetizing any sort of return on this really substantial investment that the taxpayers have made?
From my point of view, everyone wants to see that successful phase 3. We supported this from the infancy stage all the way through to actually treating patients, and we're close. I think it's a challenge when you're asking for funding for a new, extremely challenging endeavor to predict the future in terms of time scales, in terms of cost. Sometimes when you're dealing with a very immensely complex technology, it can be a little harder and take a little longer than what you originally anticipate, and that's very much been the case with stem cell-based therapeutics. So we're close. There's still several mid and late stage clinical trials coming that CERN has funded directly. It's a matter of just needing to support it a little bit further.
可以减少人有烫伤的问题，但再来，我们加州有全美国最大的 National Guard 军队那他们在 overseas 的时候，他们有些地方他们是没办法有医疗的，然后有这种 regeneration science 可以来解决这个问题。
好，谢谢。
谢谢。
谢谢。From People's Daily?
Yes.
Okay. May I have a question for you? Just talk about the future of translation from regenerative medicine to clinical therapy.
Yes, well, I see that the development from laboratory to actual practical application is growing at a tremendous rate. And that is the type of solutions we need to be looking at the problems, looking at the populations, and making sure that we'll have this available. I think the University of California, as we heard today, is leaders in this space and will be able to rapidly look at many different types of applications in this area that will benefit not only the people of California, but globally.
Thank you. And what do you expect for the future of regenerative medicine development?
I think that we're just at the beginning stages of what the applications are, and that the more we can apply this in real-world settings, and that we can support evidence-based research in this area, will open up tremendous opportunities, and that we need both government and industry support to move forward.
Thank you.
Thank you. Again, I think Jonathan will be your expert on regenerative medicine. We also do the broader technology solutions, and are actually excited about our collaborations in China. We have a number of programs that are working with the University of California system. We have a fantastic Tsinghua Berkeley Shenzhen Institute. We have another Guizhou Berkeley Big Data Institute, and we're looking forward to new ways to do collaboration internationally with our colleagues in China. Thank you.
能讲一讲今天这个活动的特殊的意义吗？
首先呢，就是说每年，就是说应该是这么说，从去年的时候，我们在这里成立的这个国际再生医学创美修复协会，它其实它的宗旨，第一呢是为了纪念我父亲，因为这也是我父亲的生日，就是今天也是我父亲的生日。那加州就把每个2月份的最后一个星期二定为这个再生医学日，然后同时在这里召开这个下午的这个 Regenerative Medicine 的再生医学的这个 briefing。那它的真正的宗旨呢，也是为了构建一个桥梁，可以让我们的这些立法人员，让这些政府的这些官员能用更切实际的方式去了解一门科学，了解一门科学体系，以及这个科学将来会如何帮助到人。那我同时呢，也是借这个机会呢，让科学家可以有一个更加接地气的这样一个沟通的桥梁，可以让他们用正常人可以理解的语言去解释科学，把这个科学传递成一种信息，这种信息可以让老百姓接受，并且让老百姓可以把它传播出去。
非常好。那么我们也注意到，从去年到今年来主讲的这些科学家哈，都是美国第一流的，就是含金量非常高。你能简单介绍一下你这个做过演讲的一些嘉宾吗？
对，因为我们去年的演讲嘉宾请的是加州再生医学研究所的主席和美国哈佛医学院医院的国家科学院的院士。那我们今年呢，把重点放在了加州大学系统。所以我们今天来的2个主讲人都是加州大学系统的专家，但是他们最大的区别是一个专家是专攻于学术、专精学术，另一个专家他主攻的是创业的这种新兴科技的体系。因为我们这样的话是今年体现出一种全新的这样的一个平台，就是说不只是了解科学，同时也是让大家了解年轻人现在的思想构造，如何能掌握年轻人现在在研发在发展未来的这个方向上可以起到最大的作用力。
那李总，您能介绍一下，就是咱们今天这个再生医学日这个特殊的意义吗？
今天是这个加州州政府去年确立的这个再生医学日，它主要纪念这个中国的这个科学家熊翔先生。熊翔一生呢就致力于再生科学的这个事业。今天我们在这里开，也代表着这个再生科学走到了一个美国的最的高度，然后得到了美国政府的这个确定啊，在州政府里召开，我觉得是非常少有的啊，所以我感觉到今天这是我们这个美宝的这个骄傲，也是我们这个再生科学领域的咱们在这个领域发展得到科学家的确认和对我们这个再生科学的地位的一个最大的一个认可。
另外，我们也注意到，就是美宝
美宝看着美宝呢，这个经过30多年的这个发展， 从中国走到这个世界，发展的非常的快。我们2019年呢，是全球的发展啊，重点是在美国，还有在这个中国，还包括世界其他国家，英国、南美啊其他国家的这个发展。尤其在美国，我们呢将有一些很多的这个新的产品，包括我们的这个新的这个药物的往前都有推进啊，都有推进。那我们的这个基金会呢，今年也会跟很多的大学继续做，包括哈佛大学、南加大、包括芝加哥大学、伯克利大学，我们还有很多的这个 UC 系统的大学 UCLA 都会跟他们取得一些共同的这个研究和共同的探讨。然后还有徐永祥大学，今年我们继续会发展我们这个大学的一些科研的项目。那这个大学今年呢会毕业，还要毕业2000多人，在今年的5月底又有新的这个大学生毕业。他们也会有一部分的学生到中国去，互相交流和访问。在5月底的时候，中国今年我们也会跟这个中美这两边的这关系继续加强我们的科研和交流，继续来发展。我希望我们的明年的时候，2022年，我们还继续在这里召开我们的会，将有更好的新的成果给大家公布。
好，非常好。